Dolan Show on TalkRadio.
Now, today is National Impotence Day. It's considered something of a taboo, but many millions of men suffer globally, and there aren't many men that don't have this issue at some point in their lives. And that's why it's fantastic to have a grown-up conversation about it and how it can be treated. First of all, let's speak to Mr. Leon Almashan, who is lead medical consultant at MansMatters, a clinic that deals with erectile dysfunction. Leon, welcome to the show.
You're welcome. You're welcome.
We're embarrassed about this subject, and we shouldn't be, because it afflicts so many people, and we are just human beings, and our physiology is subject to imperfection. Things don't always work the way they should.
Absolutely. Now, thank you for the opportunity to raise awareness of such sensitive subject.
Indeed. Why is it a taboo, do you think, Leon?
Why is it a taboo?
Why are we so awkward about discussing it? We don't have a problem with backache, do we, or knee pain?
No, you're right about this. I think in many men's minds, sexual ability and masculinity go hand in hand. And this isn't just in the UK, it's worldwide. Boys generally conditioned at a very early age about the importance of being tough, not crying and pulling themselves together. At an early age, most boys will have been subjected to taunts about their masculinity and in school changing rooms. Men also competitive. Young men brag about their conquests and the size of their penis, and most young men feel the peer pressure and aspire to being an alpha male. Talking about their erectile dysfunction to most men is a sign of weakness. Many men don't grow up, in my opinion, and I think older men can be equally as competitive when it comes to manhood. Also in society, we've seen how many relationships form. In times gone past, people formed a relationship, then after a period of time, developed a sexual relationship. Now, many people in the media and social media push sex first and the relationship second. This puts more pressure on a man. I've also known some men to be mocked by women because of their lack of manhood. In fact, there's a rise of female comedians or comedy finds mocking men's sexual ability and size. So it's a real problem.
And it's not at all funny. And I think that really there isn't a guy out there that hasn't had this issue either from time to time or regularly. Now, occasionally it's psychological, and possibly it's worth speaking to a counsellor, and certainly communicating with your partner. There can be a little bit of first night nerves, anxiety, work stress, and those are sort of non-medical issues. So that's one side of it. But a big part of male sexual dysfunction, of impotence, is actually physiological, and there is a treatment, isn't there, Leon?
Correct, absolutely. I would say 75% of erectile dysfunction causes are vascular in nature, physiological. So a problem related to blood vessels in the penis. Now, the options there, the treatments are there. For example, you've got the usual Viagra. In short term, it works, but overuse can have negative effects. It becomes less effective, annoying side effects, and your body begins shutting down its natural ability to have an erection. Penis pump, that's another one, which you can buy online, that draws blood into the penis and making it hard, but they're not the most romantic of devices. You can go to your GP and get injection therapy. Injections inject yourself at the base of the penis, and within 5 to 20 minutes, will get an erection. You have to be careful not to injure yourself, especially when you are in a rush. Now, the most extreme procedures is surgery, and that would be a penile implant. Basically putting an implant in your penis. You can never again have a natural erection. You'll lose sensitivity and penile length. Now, the gold standard, this is the exciting bit, is shockwave therapy, or extra-focused corporeal shockwave therapy. This is the most successful treatment in erectile dysfunction. In order for a man to have an erection, they need about up to 20 times as much blood in the penis as when it's flaccid. Now, shockwave generates new blood vessels in the penis called angiogenesis. The more blood vessels you have, the more blood flow, the harder the erection. Secondly, it breaks plaques or blockages in the blood vessel. That means you get a better flow. Thirdly, activate your own body stem cells. Stem cell repair damaged penile tissue. And lastly, it stimulates neurogenesis, which is a process where you get new nerve cells. And the more sensitivity, the better the arousal, the harder the erection.
Well, clearly your website is a treasure trove of solutions and treatment. The website is called mansmatters.co.uk. So take a look at that website. Lots of different discrete solutions, mansmatters.co.uk. And you've got the NHS, you've got your local GP and other options. Let's speak to Simon, who I believe is a medical doctor who has suffered from male sexual dysfunction. Hi, Simon.
Hi there. Hi, good evening.
It's really good to have you on the show. And I thank you for your candour and your honesty discussing this publicly and on the national airwaves. As I said, there are so many men, millions around the world, who have had this problem. Can you tell me how it's affected you personally, Simon?
I'm a gentleman in my early 50s, and it was quite clear that things weren't quite as let's just say strong as they were before.
Yeah.
And although I'm quite an upbeat chap, I accept that you do start to wonder, and sometimes activities can be a little bit hit and miss, and then you might try to avoid them. Plus, I have the added let's say advantage. I'm fully aware of how much this affects gentlemen across the board because of the number of people I see that actually have this problem and then come to me regarding their own problem.
Well, indeed. And it's important, isn't it, number one, that men speak up about this, that if there's a problem, they go to their GP, they check out a service like MansMatters, but they don't suffer in silence. That's the worst thing you can do, Simon.
You get lots of different guys that come through to me, and in actual fact, there are some that say, yes, we are coming primarily for this purpose, but actually, I see an awful lot of embarrassed gentlemen who will come with perhaps a knee problem or a toe problem or a neck, whatever, and finally they get round to the problem that they originally came for, which is erectile dysfunction, and they have to be relaxed enough to talk about this. And of course, if they're approaching a new doctor and a stranger to them, but their primary purpose has been that they're attending for erectile dysfunction, they come up with a list of other problems before they actually are relaxed enough and feel comfortable to talk to you about this.
Did you, with the clock against us, Simon, did you have the treatment that Leon was talking about, this sort of wave therapy?
Yes, I did. I did indeed. I've tried different therapies. I researched an awful lot, obviously medically, and I was very interested in this because with you taking tablets and everything can have a side effect. And I think it's very extreme, as Mr. Almashan said, that if you go as far as surgery, you're going to lose the ability of sensation of things. And I'm fully aware that shockwave therapy has been actually around for decades and used for different things, and it makes absolutely perfect sense.
And did it work, Simon?
Yeah, oh, absolutely. Yes.
And does it hurt? Because shockwave therapy in that department sounds a little painful.
It's not. It's very, very tolerable. I liken it to flicking an elastic band on your skin, and in different areas of the penis to obviously stimulate the blood vessel supply in those areas.
Well, I'm so glad that it was helpful, Simon. And Leon, thank you so much for sharing this conversation, this important conversation about erectile dysfunction. The website is mansmatters.co.uk. I mentioned the NHS as well. There are other pharmacies that offer solutions. So make sure that you seek out professional treatment. And most importantly, talk to someone about it and ask for help, because there are solutions out there. Leon Almashan is the lead medical consultant at MansMatters, and Simon, a medical doctor who has suffered from this problem, but not anymore. Let's talk about another problem. The BBC, why are they going after pensioners for